A lot of my patients come in and they're already taking supplements, and a lot of the supplements are really high quality, they're really good nutrients, and they're not likely going to harm anybody by doing that. But the question is, does your body need those specific nutrients?
How important is the absorption of vitamins and minerals in your body relating to the gut?
Every cell in the body needs nutrients to be able to heal. If we're not digesting our food well and then absorbing our nutrients from our food well, we can develop nutritional deficiencies. If you have nutritional deficiencies, it's going to impair your healing process. So, for example, if I have, a skin issue, right? The skin needs vitamin C and copper for collagen synthesis. It needs vitamin A. It needs biotin. It needs a lot of these nutrients to be able to heal that skin cell. If I have digestive issues, how do we heal the gut? Well, the gut needs vitamin A, it needs vitamin C, it needs zinc, it needs glycine, it needs glutamine, it needs all these nutrients to be able to heal the gut. So many of us, including myself, have gone through stages, right, where you're buying supplements because you heard it was good for you, but it's a lot of guesswork. Does your body really need that nutrient? Why are you taking those supplements? How much are you taking? What forms are you taking? How long have you been taking them? Because a lot of the times you're taking these because you think that they're good for you. Vitamin C is good for my immune system. B12 is good for my energy. Oregano is good for my microbiome. Probiotics and glutamine are good for my gut and my microbiome. So you're taking these for different reasons, but the question is, do you need those and do you have imbalances in those certain areas? And this is where testing can help solidify these answers. So if you look at a micronutrient panel, for example, we're looking at 55 nutrients inside of the cell to see if you're deficient in any of these nutrients. And this is where you can look inside the cell. This is called lymphocyte proliferation testing, where they look inside of a white blood cell, a lymphocyte, and they can tell how deficient you've been over the last 4 to 6 months. We look at 55 different nutrients inside the cell with the micronutrient panel that gives us about a 4 to 6 month window on how long you've been deficient. Not just a day, not just a week, not just a month, but a much more longer time frame to tell us your deficiency status. And the reason why this test can do this is because lymphocytes live for a long time. With this test, we're then able to give much more specific guidance when it comes to nutritional supplementation. And that can help us really individualize the protocol. For example, if someone's low in B12, how much do I take? What form do I take? How long do I take it for? There's with or without food. There's all these different questions, right? And that's what we're here for, is to kind of guide you in that situation. B12, I mean, there's so many different forms of B12, and do you take it with or without food? Vitamin C, there's different forms of vitamin C. Magnesium, there's a ton of different forms of magnesium.
What can severe nutritional deficiencies look like?
Probably the most significant test I've ever seen is someone that had about 30 nutritional deficiencies out of 55 nutrients. And that's a lot of nutrients, right? Like, how are you going to possibly supplement with that many things? And we prioritize it and start from the most highest priority and then work our way, through that task. But, how would they present in terms of symptoms? I mean, fatigue, it might be inability to, gain weight. It might be things like, maybe that came from like a chronic digestive issue. They're not absorbing stuff over time, even though they're eating plenty of food. Are they digesting that food and are they absorbing the nutrients from that food is the question. And it can affect, red blood cell production, white blood cell production. It can affect a lot of things systemically, just because when you have that many nutritional deficiencies, that many cell types are not going to be firing on all cylinders and functioning at an optimal level.
Do you think that food allergies, food sensitivities can have any relation to nutritional deficiencies?
So there is a relationship between food allergies, food sensitivities, and nutritional deficiencies. But the way it's related is usually because there's leaky gut present. And so with leaky gut, where the barrier, so like if you have a barrier, they got these cells are supposed to be really tight. When those barriers are breached and compromised, you get these bigger openings where foods and proteins and microbes from the gut can leak into the bloodstream, which causes an inflammatory event. Well, when we have things like leaky gut, now we're not absorbing our nutrients anymore, and we're more sensitive to foods typically. So now you have a situation where you have more food allergies, food sensitivities, and more nutrient deficiencies. And then you have to figure out, well, what's the root cause, right? Did the food eventually break down the gut? Am I under a lot of stress? Was it, certain dysbiosis? Did I get sick? And then that happened after that, like influenza, for example, lack of sleep, right? Certain medications can do it sometimes. So what's the reason why that gut wall breaks down and that barrier is compromised? Because that can set you up for food allergies, food sensitivities, and nutritional deficiencies.
And how have you had so much success with your patients at RHS, Dr. Paul? I mean, so many come in to see you that have nutritional deficiencies, they have food sensitivities. What do you attribute your success to in working with your patients?
Biggest reason that we have success here is because we do thorough testing and try to figure out every different avenue that can affect gut function. So, for example, if someone comes in with bloating, say I just do a stool test. Okay, well, sure, it can come from bacterial overgrowth, yeast overgrowth, parasitic overgrowth, low stomach acid, low digestive enzyme output, but it could come from chronic stress. It could come from food sensitivities, food allergies. All these different things can contribute to very similar symptoms. So if I'm just looking at one test, it really limits the amount of data I have to try to figure out that exact root cause or root causes as to why that's contributing to their symptoms. So thorough testing and the test don't guess approach, right? The more you test, the less you guess is the reason why we have success. And also communication with patients. We try to really be good with communication in between appointments, education, and then at each visit, I bring up the test results and I remind patients where we are in the stage of their protocol in terms of here's what we're doing now. How'd you do with that? How you feeling? And here's the next stage, and here's what we're going to change. And that's why the follow-up visits are really important too. So it keeps people on track. So it's thoroughness of the testing, understanding the mechanisms, and communication, and just consistency and compliance with the protocol over time, I think is what gets us the best results.